This Week in Virology, the podcast about viruses, the kind that make you sick. From Microbe TV, this is TWiV, This Week in Virology, a special episode recorded on December 12th, 2019. I'm Vincent and you're listening to the podcast all about viruses. Today we are recording at the Environmental Health Institute in Singapore. My guest is the director of EHI, Lee Ching Ng. Welcome to TWiV.
Thank you. Thank you for coming.
I practiced saying your name a lot. I hope I got it right.
Sorry to have a name without a vowel.
No, it's okay. Mine is hard to pronounce also. So I wanted to talk about what goes on here at the Environmental Health Institute. I have to say, we just got a tour of your mosquito production facilities, and it's amazing. So we'll talk a little bit about that. But I wanted to first ask you a little bit about your training and education that brought you to this point. Where are you from originally? Are you from Singapore?
I'm 100%.
100%?
Bred and trained in Singapore.
And you went to university here?
Yes, NUS, National University of Singapore. I did my degree, bachelor and PhD in microbiology, and went on to do molecular microbiology. Subsequently, got a job here to do dengue viruses.
At EHI?
At EHI. I mean, in things in between, but eventually doing public health at EHI. And learning a lot about entomology, epidemiology, and general field ecology. Yeah.
So how early in your life do you remember being interested in science?
Oh, has always been more tilted towards the science side. Certainly not the art and the humanities.
And how did you come to the director position here?
Well, I was recruited as a head of department, and then subsequently, I was previously working with DSO National Laboratories, and was recruited to join public health over here to lead the department. Okay,
so you oversee all the things that go on at EHI.
Yes, that's right. So we have different programs. Vector-borne diseases is one of them. It's a key major program here, but on top of that, we have other things like environmental microbiology, antimicrobial resistance, even indoor air quality, and also outdoor air pollutants. So we provide the science, the risk assessment for operations and policies at the National Environment Agency, which is the authority for environmental issues in Singapore.
So what is the structure? So the EHI is part of what?
Part of National Environment Agency.
Okay.
So it's it's a statutory board under the Ministry of Environment.
Ministry of Environment, okay. So that's separate from the Ministry of Health.
Yes, it's separate.
Right, two separate things. Okay.
More taking care of environmental issues, including infectious disease of environmental concern. With environmental drivers.
Sure, because there are drivers of infectious
disease. That's right. So, example, mosquitoes.
So this site where we are now is focused on mosquitoes.
Yeah, that's right.
But there are other sites too.
Yes.
Where you do diagnostics, for example?
Yes, that's right. So the molecular lab, the microbiology lab is at Biopolis. Here at Mosquitoes, it's just producing mass production of mosquitoes for release.
So let's talk a little bit about what's not here. The diagnostics. How does that work? Because I know that NCDI, is that right?
Oh, yeah.
NCID, where I was this morning, has a surveillance team. What do you do that's different?
So what we set this up quite earlier on, more than 10 years ago now, I think about 15 years.
Yeah.
It was purely to facilitate vector control program. So we have an operational group, EPHOD, the operation department, where they respond to cases, cluster transmission to do vector control. Of course, we have the routine inspection and control measures to suppress the mosquito population. However, when there's transmission, we will then have to go in to do enhanced vector control. So case surveillance is then very important for us. So when we started the program to do diagnostic, it was really to encourage the primary healthcare system, like the GPs, to consider dengue, to do more diagnostic testing. And so we offered a testing service for the GPs. So they send samples here. And it was also to facilitate virus surveillance. In 2004, what we observed, 2004-2005 outbreak, what we observed was that the outbreak was associated with a serotype switch. So we have 4 serotypes in dengue, and what we have seen and confirmed later on is that when there's a serotype switch in a predominant serotype, now Singapore has got all 4 serotypes. So when there's a switch in a predominant serotype, we get an outbreak 3 to 6 months later. And so all these effort in surveillance to enhance factors, to enhance case surveillance and to enhance virus surveillance was really driven by the need to respond early vector control in the community.
So you look at cases of dengue, you look in the vector, the mosquito for
That's
virus, right?
The viruses come from the cases. It's the easiest way to get a virus, to know what is circulating in the environment. So these cases that we picked up are then reported to MOH, Ministry of Health. So it's part of the same surveillance system, just that we try to enhance it by encouraging the primary healthcare, like the GPs, to order a test. And that was pretty new. 15 years ago, if you follow the dengue diagnostic history, it's only about 2008 that NS1 test, the very easy point of test was made available. So before that, there was really no early test except PCR, which was not regularly performed for dengue in the private sector, in the private clinical laboratories where the GPs usually use. So we started off offering PCR until 2008 when NS1 became available, and we then helped to roll out NS1 test. So overall, the objective and the motivation is to improve and to better our surveillance among the primary healthcare.
Okay. So, and then also you were interested in the mosquitoes.
Yes,
right?
that's
So
right, certainly.
Do you assess mosquito levels?
Yes. So we also then developed a gravity trap. Have you got a chance to see that?
Yes.
We'll show you.
We saw your video.
Yeah, the little trap that we have developed, that was also more than 10 years ago when we started developing that, and did a lot of field trials, pilot trials, and today we have more than 50,000 of these traps all over Singapore. Each of the public housing flats would have about 6 traps each at different levels.
Right.
So the public housing is closely, the mosquito population in public housing is now closely monitored by the gravity trap system. So when it comes to surveillance, we have got 4 pillars: the virus, case,
That's
very
from
much
people, right? The virus
from
comes
people,
from
yes,
people,
mainly by people. And then Ministry of Health does the case surveillance, and we do our operational department then does the vector surveillance. And on top of that, we also monitor the climate, the weather parameters very closely.
Okay.
And that also, that division is also under National Environment Agency, same agency. So we collect data from there.
Got it.
Yeah.
So let's go back to the gravitrap. So the mosquito goes in, it doesn't get out. Right?
Yeah, that's right.
So periodically you collect these,
Every 2 weeks.
and what do you do with them?
So it's brought into the laboratory for identification for species. Whether it's particularly, we have 3 common species here: Culex, one of the Culex species, and Aedes aegypti and albopictus.
Okay.
So these 2 are our target for gravitrap.
And so you look at numbers,
Numbers,
and you can see with time
Yes.
whether you get differences, spikes, or
Yes,
whatever
that's right.
that is.
And then we also can look at it from the national level, right? Or very localized level. Which block has got more breeding, has got more mosquito, or even just on the level of the block, the public housing, the apartment blocks,
Right.
whether we have more mosquitoes on the top floor or ground floor. And that actually helps a lot in a targeted inspection and search for mosquito breeding. So our fundamental here is, or for vector control, is inspection and source reduction, removing breeding habitats from the environment. Yeah.
Right. So you encourage people not to have standing water.
Yes.
In fact, you fine them if they have standing water.
That's right.
Which is a great incentive. Which
So it's both. We have a lot of education,
Yeah.
a lot of soft approach, but at the same time, there's a monetary penalty for compromising public health.
Yeah. So one of the things that's really interesting, and I didn't know about, is that Singapore has got a lot of high-rise buildings.
That's right.
It's a small island with a lot of people, so you have to build up.
Yep.
And I didn't realize the mosquitoes are populating the upper levels,
That's right.
which is news to me. I thought they typically remained underground.
Yes, so it really shows they adapt very well to urban environment like this. As long as, especially Aedes aegypti, as long as you have man-made containers, they're happy.
So what are they feeding on the upper levels? People, but the males are probably feeding on plants, right?
Plants, that's right. So there are also plants all over.
Everybody has plants. Yeah.
Yes.
And
a lot of people
buildings,
would have plants all over.
we have plants behind us.
That's right. So it's part of our effort to green the city as well, right? We have a garden city. Used to be called a garden city, and now city in a garden. And there's even more effort now to really to mitigate the heat island effect and climate change, is to have more greens. Yeah.
Right. So you have gravitraps up and down buildings as well as horizontally.
Yes.
In strategic places, right? So you have a lot of people that have to go out and collect these.
That's right. So currently it's rather labor intensive, but we're working on automating it. So it's there now. The prototypes, we've got 10 prototypes on field trial at the moment, where whenever a mosquito comes in, we detect by biological like wing beat, and so when it comes in, we know what species it is, and the data get transmitted back to our office. You can monitor, you can adjust it whether you want immediate alerts or sort of interval alert.
So I spoke with a group from Microsoft who's developed these mosquito traps with doors, and the mosquito flies in and the door shuts.
Yeah.
So you could use that also. I mean, they're delivering it by drone to remote locations as a way of monitoring viruses in animals. Forest, for example.
I think that would be interesting.
But in your case, you could leave traps like that, and they could just transmit.
Yes.
So you could have a little camera in each one, and it would transmit it. You wouldn't even have to go collect them.
Yeah, I think that would be the way to go, really. And with the Internet of Things, with Singapore going towards being a smart nation, these all fit into the whole scheme of things.
So if you see an increase in mosquito populations, which may correlate with what? Increased rainfall? Increased temperature? What would be the...
increased temperature, increased rainfall, but sometimes when the rainfall gets too high, population drops as well. So it's very complex.
It's not straightforward.
It's not straightforward, because you have so many stages of the mosquito population. But it also depends on human behavior, because Aedes aegypti is really, they breed in man-made containers.
Right.
So if we were to not leave containers out there, you will not get mosquito breeding. So human behavior is something, again, very difficult to track. Like, for example, we get sometimes certain years we get more mosquitoes during December. So you wonder why. Is it climate change, or is it because a lot of people are on holidays?
And there's water collecting. And
so
breeding.
There's no evidence either way. So I think it's very complex when it comes to environmental driven infectious disease.
So you have mosquitoes all throughout the year, right?
That's right.
See, where I live in the northeastern U.S., they're not around in the winter.
Yes. So your mosquito control people can take a break. Here, there's no break. Whole year round.
But they are somewhere. The mosquitoes go under leaves and so forth, and they hibernate for the winter. And in New York City, they live in the subways. Or they become dormant in subways
Yeah.
because it's not as cold there.
Yeah.
But here you got it all year round. So what kind of climate, you said earlier you monitor climate.
Yeah.
What kind of changes would tell you that there might be a problem with
Mainly temperature.
increased temperature?
Increase, but beyond a certain level, like 36, 37,
Yeah.
you start seeing plateauing and perhaps dropping as well. So when it comes to temperature, there are two factors. When it comes to dengue transmission, temperature affects two components. One is the mosquito population,
Right.
because it increases the replication, the
Right.
multiplication rate of the mosquito. The other one is the virus replication. So it shortens the extrinsic incubation period.
Right.
A mosquito will get will become infective a lot faster under hotter climate. And so more mosquitoes will be infected and you have higher epidemic potential. So in this case, if your virus will be about 37 degrees as optimal, whereas mosquito is somewhere perhaps lower, not too sure how much, 30 plus, but not as high as 37.
Yeah.
So beyond 33, 35, you have this counteracting factors, pulling and pushing. So it gets very complicated. What exactly is the temperature where you see dengue transmission falling?
And if the temperature drops below 30,
Yeah.
I don't know if it does that here in Singapore, does it?
does, yes. The last few days has been very good. Yeah.
But what is the lowest temperature you would get here?
22, 23, lowest in the
Mosquitoes
evening.
will still be around
yes,
that, yeah.
Certainly. You see 18 degrees in Rio and you still get transmission. Yeah.
All right. Now, you don't look for virus in mosquitoes yourselves here, right?
We sometimes do, depending on the situation. In fact, the chance of finding it is so low. It's 1 in 1,000 mosquito, 1 in 10,000. So we didn't see that it was very cost effective to do that all the time. However, in certain situations like Zika outbreak, everybody was very concerned. So in that kind of situation, we do. Yeah. We don't do it on a regular basis.
So I know from talking from other people here that there are periodic outbreaks of dengue, right?
Yes.
That occur where the cases get higher than normal.
Yeah, that's right.
And so when you're doing your surveillance of mosquitoes, do you see any changes that correlate with that?
So we know that when mosquito population is high, you get a higher risk of dengue. So it does not mean that you will get dengue when the mosquito population is high.
Right.
So that's what we saw.
Higher risk, yeah. Okay.
Yeah, 2018, we had high mosquito population, it was rising, but we didn't see outbreak. The outbreak only came in 2019.
Right.
So obviously, it's a risk because there are so many other factors coming in. You have the virus epidemic potential. You also have, it's all about the probability and the chance of the three meeting, right? A susceptible individual, a mosquito, and the virus. So that interaction is very complex. And when we talk about whole population, our immunity level is very low in Singapore. At the age of about 20, maybe 16% of the people, about 16% of the people would have had dengue before. You have IgG, which means the population is very susceptible. But that's not the same throughout the whole country, because as you age, you will have higher immunity. So again, in a localized setting, it's hard to predict because of the differing demographic. It's then hard to predict where the outbreak will be.
So aside from dengue, what other arboviruses do you worry about here?
We have had chikungunya outbreaks twice so far, 2008, I think, and 2013, and then Zika outbreak in 2016, all borne by Aedes mosquitoes.
Right.
Yeah. Chikungunya was more Aedes albopictus. You know, the A226 mutation that caused it to adapt to albopictus. So we saw chikungunya more in albopictus areas, more rural, not so much in the, not as much as dengue in the urban setting.
So if, let's say there were a new virus outbreak that you'd never seen before here, How would EHI become involved? Would it only be involved if it were a arbovirus, for example?
Yes, only arboviruses because of the environmental risk factors that drives it. Yeah.
Because that's what's in your environmental is your name. So
Yes, that's right.
You know,
So NCID does the rest. We have NCID. Yeah.
Yeah, I understand. But I mean, viruses going from bats to humans could have an environmental component
Yes,
as well, but
that's
you don't
right.
get involved with that, right?
No, not at the moment. No.
Because I understand there are a lot of bats in Singapore,
Yes.
and they can harbor viruses,
Yes.
and so there is some risk, but you wouldn't be involved. That bit would be other.
Really, we are whole government in Singapore. We deal with a lot of problem as a whole government.
Yeah.
So we never know. We know that we have a network of laboratories, network of researchers that we can come together anytime.
Okay. So this EHI is also a World Health Organization collaborating
Center.
What does
Yes.
that mean?
That means we support WHO in their mandate or their function to help build capacity in the region or in the world. So one thing that we do, for example, is a regular course. We have the dengue workshop, Singapore International Dengue Workshop that we conduct here. It has become a yearly item now. Used to be just once every 2 years. So last year, for example, we had more than 100, I think it's about 100 participants here in Singapore from all over the world, learning and exchanging ideas on dengue control, clinical management, and diagnostic laboratory surveillance, 3 tracks. So this year we also had one session just on mosquito control. On top of that, we also help in providing testing kits sometimes to areas with needs, emergency needs when there are outbreaks. Yeah.
So would you say that much of Singapore is aware of mosquitoes and what they can do?
Yes, I believe so. In all our surveys, it has demonstrated very high awareness among Singaporeans on mosquito issues. My daughter was about 3 or 4 long ago when she was 4-year-old. She came home and said, Mama, please clear the water, otherwise there'll be mosquito breeding. She came back to teach me about mosquito control.
She learned it at school. Yeah.
So learn it at school, even at 3 to 4-year-old.
Yeah.
So the awareness is high. However, practice is another matter. I think most of the survey shows the same thing.
Yeah.
Or internationally, practice is never as high as the knowledge.
I mean, in the U.S., certain areas are at risk for mosquito-borne diseases, but I don't think the awareness is as great.
Yeah.
It's a tropical country, and they're here all year round. So
But I think it's getting there. With the Zika, especially.
Probably that helped, but it was only in Miami and Texas,
Florida,
local transmission. So those areas are aware of it.
Yes.
Other parts of the country say, "Oh, it's not my problem."
That's right. And I heard even California has got Aedes aegypti now. So the same mosquito suppression method has been used in California.
Well, as temperatures rise, then the Aegypti range will move further north. As you know, the albopictus range is much farther north in the U.S., but it's not vectoring anything of consequence in the U.S. yet, anyway. Our biggest issue is West Nile, and the culisine mosquitoes throughout the country do that. And you have those here as well.
Yes, we have.
Right?
Yes.
But you don't have
we don't
West
have West
Nile.
Nile, no.
Right.
But it's moving upwards. You can see that very clearly in Europe, where a lot of surveillance has been ongoing. You get it in Croatia, in
Yes, there's no doubt about it that
so
the range is changing. Yeah. Let's talk a little bit about Project Wolbachia.
Yeah.
What is that?
So
something I spent the morning
Yes.
looking at here. It's wonderful. Tell us about it.
So it's very exciting. It's an exciting project. I think I would always say, so far I've been 15 years in the public health, dengue control research. What I have discovered compared to other areas is that how lack of technology we have, it has we have relied on door-to-door knocking, chemicals for 15 years, for many, many decades. And so finally, it's really exciting that we have new technologies coming in just when we really need it because of climate change, because of the movement of mosquito spread. So this is Wolbachia, which is a bacteria. It's a natural bacteria that can be found in 60% of the insects. But Aedes aegypti does not carry Wolbachia. So, but when a male mosquito, when we insert a Wolbachia into Aedes aegypti, and the male of this Wolbachia mosquito mate with a female that does not carry, they're not compatible. It's a cytoplasmic incompatibility. So there will be no progenies. The eggs don't hatch. And if you imagine then, if we were to constantly regularly release this male mosquito, we get a suppression of the mosquito population out there. So in Singapore, we used to have about 50% of our household were found breeding mosquito, which means every 2 homes that you go to, one would be found breeding mosquito.
In the actual home?
Yes, in the actual home in the 1960s, 70s.
Yeah.
And then after implementation of all these source reduction and community engagement, we saw the mosquito population really dropping. And now we are down to about 1% or less than 1%.
1% of households having breeding.
Yes, that's right. Which means our inspectors will knock on more than 100 homes, 100 to 200 homes, to find one breeding. Demonstrating that the population is very low and it's also difficult to find now. And perhaps there are cryptic sites and things like that. So this is very handy now, complementing what we have already done to press mosquito population down, and hopefully we can further suppress it, the remnant, with the Wolbachia technology by sending this male Aedes aegypti, Wolbachia Aedes aegypti out, seek out the female, and take down the small population. Yeah.
So this would be used in addition to other reduction approaches that you've talked about, right?
So it has to complement.
It's not going to replace it.
No. In fact, I think it will be it's theoretically, and we have seen it as well, that if there is a lot of breeding in a community, the technology suffers. It does not work very well. It hampers the technology. Then we will have to release a lot of mosquitoes to compete with a community mosquito. Yeah.
So here you have a mosquito production factory.
Yes, that's right.
Which we toured. It's really remarkable. You can take mosquito eggs and you let the mosquitoes lay eggs. You can hatch them. You can take the male larvae. Specifically, which have the Wolbachia, and grow those up, and eventually you'll be able to do millions and millions and millions, right? And then release them. So I want to explore that a little bit. So first, how long has this release program been ongoing?
It's only a research program. So we started in 2016. First phase, we simply just tried to. It was a very small site, about 10 apartment blocks. And maybe 2 sites, so about 20 apartment blocks, where we just try to understand the mosquito behavior, like you said. How high would they fly? How far would they fly, the males? We used to have data, but it was from females. But now, what about the males? So we released and start trapping, and had a very good understanding of what was going on when you release these males out there. After all, they are laboratory bred, right? So that's first phase 1, but incidentally, we just collected data and saw about 50% of a reduction in the mosquito population. But we also know that because Singapore is very dense, all the housings are close together, wherever you release and clear a spot, you will have migration of mosquitoes coming in. So that 50% was probably due to migration issues.
If you clear out some, the other wild mosquitoes will come in. That's the problem.
That's right. So what we caught was probably a lot of migrant mosquitoes. So we then tested a hypothesis by saying, okay, let's then expand our site and have a buffer area. At the same time, we release from the top as well. And with that strategy, the center spot, the core same area, went down by 70%. Yeah. So then that seemed to work, suggesting that the bigger area you have, the more effective it will be. So phase 3, we expanded even further, And now we got 90% reduction. And with that concept, now we are trying to expand to bigger areas. Yeah.
So I noticed in the video I saw that you have kids opening
Yeah.
jars of mosquitoes and releasing them. So you
Yeah.
engage the community.
Yes, that's right.
Did you tell them ahead of time you were going to do this? I presume?
Yes, a lot of engagement. In fact, half my time is spent on developing engagement material, planning for an actual engagement itself. Half of my time on the project. Yeah. So yes, it's very. We really want the community to understand it.
Yeah.
So we make very clear. We try to have very clear messages, simple messages, and been transparent. Where we're going to release, when we're going to release. So and different platforms as well. We use door to door. We have pamphlet going door to door, so every household is reached. And then we also have road shows where places with high footfall, the engagement team is there to explain, to spread the message. We use social media, classical media, all different platforms to just reach out. So thanks to the community, they are very, very supportive, and we have the grassroots leaders and advisors supporting us, even helping us with the engagement as well.
So overall, it's been well received.
It's very well received, yes.
And there's very little resistance. So going forward, you're not going to see any issues with that.
Well, we'll be very careful. I wouldn't say there will be no issue, but I think there's no complacency. Doesn't mean that it's successful in the past few years, you'll be successful in the future. So we'll be very careful with our engagement to make sure that every individual is engaged. Every individual who is interested will be engaged. Yeah.
So eventually, I guess you have to, so you release on the ground and in upper floors. Eventually, you have to cover most of the island, I presume, right? Because there are mosquitoes everywhere.
Yeah,
right?
that's right.
So is that part of your plan?
Yes. So if you look at it, the whole situation now is that we know we have a tool that works.
Right.
If you put mosquitoes in a reasonable number in the community, you're able to suppress it. However, we haven't got the strategy, the tactics in releasing this mosquito, right? For example, we talk about use of drones. Could that be a possibility? So we are testing them.
People would probably get scared. Just see a drone up on
So in that case, we also have been engaging. So we have been, we told the news, we're going to test them. No guarantee. These are all research, no guarantee it will work, but we're going to test them. And how do we then deploy? Are we going to deploy by walking out, or are we going to deploy in high-risk areas? So we have also, all this work is going to be supported by a lot of previous work that we have done. For example, you saw the gravity trap. Without the gravity trap system, this trial would have been difficult, right? So another work that we've done is data analytics. A lot of effort has gone into identifying high-risk areas by different layers on the GIS map, including satellite images and all that. So we know where the areas where we have high mosquito population and high risk of dengue. So that could be another strategy for us to work. Do we really need to take down, really need to release whole country? It's a question mark. So in other words, we do not know how to use the technology yet. It's there.
Yeah, as you say, it's a research project. You have to answer these questions. Because if you don't need to blanket the entire country, there's no need to do so.
Yeah.
But you have to figure out.
So I would say this stage is really about optimization.
Right.
To how best to use this technology.
And I guess one of the questions I have is, you can suppress the mosquito population. You've shown that locally, right? I saw some very nice pictures of apartment complexes that were red, where there are a lot of mosquitoes before and they're white afterwards. It's great. How does that correlate with incidence of vector-borne viruses?
We haven't analyzed that yet. The area is very small, so moving forward, the next trial will involve epidemiological outcome that we'll be working with the Ministry of Health.
Right. because you need to know if it really has an impact on, say, dengue
Yes.
transmission.
So
or
the
not.
data would come from Ministry of Health, yeah.
Right. But you have to work with them. That's a really important question, right? Because you
Certainly.
can show that you can get the mosquitoes down, but the question is now, you don't just want to do that, you want to impact transmission,
Yes.
right?
Certainly.
So you have to do that. So you're looking at Aedes aegypti. So let's say you get rid of Aedes or you push Aedes aegypti low enough. And by the way, you need to continue release. You can't stop, right?
We, again, we don't know how to use it eventually. What we have seen in places where mosquito population has really gone low, we could afford to stop for a few weeks. So it really depends on the surrounding area. Very often we may be able to take down the mosquitoes in one
Yeah,
area, but
right.
there's migration.
Yes.
So I think the bigger we go in area, there will be pockets that we can stop releasing. So we'll have to assess that. Yeah.
Right, right. But you don't think you would ever get rid of Aedes aegypti entirely, right?
Being urban and having an open, rather porous border with a lot of
Hard.
with the busiest port in the world,
Sure.
one of the busiest actually. It's probably very difficult to eliminate. Yeah.
But at one time, there was no Aedes aegypti here, right? It was introduced.
Long ago,
Long
I
ago,
think.
yeah.
We don't know any time like that.
No, I think it originated in Africa and it
Yeah,
spread
that's
to the
right.
rest of the world, right?
That's right.
But,
But I think Asia was one of the first areas with dengue transmission.
Mm-hmm.
Yeah.
do you worry about other mosquitoes becoming a problem? If you depress Aedes aegypti sufficiently, will other mosquitoes move in?
Yes. So certainly, there's a lot of speculation that if you suppress Aedes aegypti, albopictus population will take over the niche of the vacated habitat, right?
Sure.
So thanks again to the gravity trap, we are monitoring. We haven't seen that occurring at all, which also demonstrates the importance of the normal vector control that we cannot dismantle. We know that, the community-based vector control, vector suppression. Yeah. So yes, we are watching, and we also have plans. If it really happens, we can also use Wolbachia albopictus.
Right.
To suppress albopictus.
Okay, so you are considering using other mosquitoes in the future if you need to.
Yes. So because the skill set, the knowledge is already in-house, it should be easy to do. Yeah.
So from what I've seen, this is quite a production here to make all these mosquitoes, and amazing technology that has been developed so that you don't have to do it manually.
Yeah, that's right.
And it costs money. So is it possible that it will cost too much money to do this versus the benefit of reducing, say, dengue? Because if I understand correctly, what I've learned on this trip is that most of the cases are pretty mild in
that's
people.
right.
So do you think that there would come a point where the Ministry of the Environment, right, would say, okay, this is great, but it's just too expensive for what you get? Is that possible?
We have to do our cost-benefit analysis,
Yes,
which is ongoing at the moment.
Right.
So no comments on that, but it does show a lot of promise.
I think you don't know the answer. You have to assess it.
Yes,
Like, today you can't really say.
At the moment it looks expensive, and because it's not a turnkey technology.
Sure.
We're still developing a lot, and like all technologies, I believe the price will drop, the cost will drop, and especially when more people use it, economy of scale, you will see the price dropping.
Right.
So I think it's too early to decide.
Is this the most, there are other programs of release. There was one in Australia, there's some in Brazil.
That's right.
I think Google is even
Yes, so we work with Verily. They have the subsidiary of, I think the alphabet family is Verily. So we are working with them as well. They have the technology to sort the mosquito, the males and the females.
Is your program the most ambitious as far as you know?
Sorry, again?
Is your program the most ambitious? It seems to me it is. But
actually it's not.
It's not?
It's not. China has got a big program in Guangzhou. So they are targeting albopictus. So they have a bigger program there.
I see.
Yeah.
I'm not
But
aware of that.
the Australian one is quite different. Brazil, Australia, Vietnam, they come under another brand name, mosquito.
Oxitec?
No, World Mosquito Program. So they are using Wolbachia, but they what we call the introgression. What they want is to introduce Wolbachia mosquito into the community. And Wolbachia blocks transmission. So it's a very different
So
approach.
it's in the females because that'll block virus replication.
Yes,
right?
that's
Yeah.
right. So using same Wolbachia, but we exploit the different phenotype of the Wolbachia mosquito.
So that approach does not depress the mosquito population.
Yeah. No.
It just makes them resistant to virus.
Yeah,
Your
that's
approach depresses them.
Yes, that's right.
Well, both have to be looked at for sure, right?
Sure. But what we are doing is consistent with our program. Yeah.
So we've talked about some of the aspects, but is there anything that you look at as a challenge in this program? It seems to be all going beautifully well. Is there something that bothers?
But that's the fun of it, right? First, we had a hard time counting larvae, and now we have a solution, and that's kind of satisfaction, taking small steps. Every little bottleneck that we have, we resolve it, and you take little small steps, and then you realize once you resolve this, another part becomes a bottleneck. And so we are going around, if you look at the whole production to the release, there's a whole chain of activity, and we're trying to fix everything to optimize every section, every process. So that's, I think, very challenging, but very fun as well. I think I really enjoy it because it's really transdisciplinary and integration of all kinds of sciences into this program. We have myself as a microbiologist, I have my colleague Vincent, entomologist, and then we have mathematicians, and now engineering solution as well, putting physics and lasers and things like that into the whole solution, which I think is the fun part of it's a very effective and yet very fun part of the program.
It sounds like an interesting place to work because you have all these different expertises plugging in together.
Yes. Yeah. And we also work with, besides Verily, we also work with local startup company, Orino. So the interaction with commercial company and academia has been very enriching.
So is this, so you're willing to work with other countries to help them implement this in their area based on what you've learned, right?
Working to implement, I think we need to sort it out here first.
Sure.
To really understand the tool.
But if someone came to you and said, we would like to learn from you how to grow mosquitoes like you do, you could help them.
We do that. In fact, 2 weeks ago, we just had a course here about mass rearing.
Mass rearing of mosquitoes.
It's 20 over people from 10 over countries. We're here, and I would say, yes, we provide the facility, we have a lot of knowledge, but it was very mutual exchanges in strategies.
So let me ask you two final things. I noticed you published some papers on your work. You're on a lot of papers.
Yes, thanks to the great team I have.
you like to do that, publish it and make it public. So one of them was how patterns of urban housing shapes dengue epidemics. So how does housing impact? Is that having to do with mosquitoes like we talked about?
So we talk about vector control, all the inspection and all that, but a lot of it, I would say, a lot of this control is about environmental management. It's how do you build infectious vector-borne disease out. If you had come in, I don't know whether you were here in 1980s, 1970s, when we have the kampong, the small villages, where dengue could be rampant. So by cleaning up the environment and putting people on high-rise housing has actually helped in reducing the risk of dengue. So we believe that vector control or control vector-borne diseases can be very much facilitated by environmental management and not just chemical or Wolbachia or whatever. It's about
another paper you wrote is construction sites as drivers of dengue transmission. Why would it be a driver?
What we had for a few years, we had construction site outbreaks, and when there's an outbreak in construction site, often it's big. It's it's a
So
bigger number of cases.
The people
Yes.
working there would get.
People working there.
Okay.
And we know construction site has got so many artificial containers.
Yeah.
And it's usually
Yeah, sure.
more uncamped. So we did an analysis and showed that if there's an outbreak in construction, not all construction sites have outbreaks, all right, but once it hit a construction site, it has a tendency to become bigger than a normal built setting.
And I notice there's a lot of construction going on still
Yes.
here.
So we do a lot of engagement,
Yeah.
and I think I must say that in the last few years, it has dropped significantly. If you look at construction site, the barrier,
Yeah.
you will see usually there will be a few posters on dengue, on how to prevent dengue control, source reduction.
Right.
So we work very closely with the contractors as well to create awareness, and I think it has we have seen results on that.
Okay. So you think that making them aware will
Yes.
help to? Have you monitored this? Do you go to construction sites?
Yeah,
you put gravitraps there and.
Not with Gravitrap yet. We do a lot of inspections.
Okay.
Yeah.
So if you find mosquitoes breeding, do you tell them you have to get rid of? Do they usually comply?
Oh yes, yes.
Yeah. That's an interesting example. So on a daily basis, what is your job?
My job.
Yeah. You don't pipette. You don't do experiments, right?
I don't do lab experiment, but I do enjoy going to the field. Lab experiment has a lot of continuity. You know, I cannot cope anymore. But I really enjoy going down to the field, whether it's release or releasing mosquito or catching mosquitoes. So we have another project, for example, trying to understand mosquito population out there. We have got more than 100 mosquito species in Singapore. You think it's so, you will look around and say hardly any mosquitoes, and such urban setting, you wouldn't get a diversity.
Yeah.
But we do have a good biodiversity here if you go to the forest.
Where is the forest here?
You want to go? I bring you.
I haven't seen any forest here.
Serious. We have a primary rainforest just beside us, and it has got fantastic biodiversity there. I think it's equivalent or more than North America. Just that little plot of land.
Wow.
Yeah.
Wow. So it's a home to many mosquitoes, probably.
Yes,
Right?
mosquitoes, birds, everything. So we do have a good diversity. But having said that, those are very few are vectors. That those are non-vectors, most of them. Yeah.
Okay. So many people will hear this episode. Is there anything that we haven't covered that you would like them to know about what's going on here?
No, I can't think of anything.
Okay. We've covered a lot, right?
Yeah.
Okay. So that is our special episode of TWiV. You can find TWiV at microbe.tv/TWiV. And questions and comments, TWiV@microbe.tv. My guest today is the director of the Environmental Health Institute in Singapore, Lee Ching Ng. Thank you so much
Thank you.
for joining me. I appreciate your time. I'm Vincent Racaniello. You can find me at virology.ws. I want to thank ASV and ASM for their support of TWiV and Ronald Jenkins for the music. You've been listening to This Week in Virology. Thanks for joining us. We'll be back next week. Another TWiV is viral.